Hi, I'm Erinn Quinn. I'm the Klickitat County Public Health Director. I just started recently and I'm really excited to be here. Obviously, normally I'd wear a mask. I'm in a safe place right now where I can unmask and have a good conversation with you. I moved to Klickitat County in 1984 with my family. I went to Goldendale schools. I graduated from Goldendale High School. I went to college. I graduated with my registered nurse degree from Columbia Gorge Community College. We were the first nursing class that graduated from Columbia Gorge Community College, so I was really excited to be part of their program. Later, I actually went back and was an instructor with them as well, and it was really good to give back to the nursing instructors that had really helped me. My advanced degrees were from WSU, and in my nurse practitioner program, I was introduced to a preceptor who had retired from the military and recommended that I join the Army. She said it would be fun, so I should do it. I went down to a recruiter and I signed up for the Army when I was 34. And I'm still in the Army Reserves today. I started with Klickitat County Health Department as the director in March. I worked there for 4 days before I was mobilized with the U.S. Army Reserves in support of COVID-19. We were mobilized as part of the Operational Command Post at Joint Base San Antonio, managing COVID on a national level. While it was difficult to be away, I'm really excited to apply the lessons I learned on a national level to Klickitat County. This is my third time working for Klickitat County Health Department. I started in 2006. I was a staff nurse. I did family planning. I was part of the immunization program and communicable diseases, which is my all-time favorite part of public health. I was at the health department during H1N1 and really helped with the immunization programs, and we did a lot of pandemic management, so this isn't my first time managing a pandemic, although very much different than the H1N1 today. My second time working for Klickitat County Public Health, I was the nursing director. While I was there, I was going to nurse practitioner school, and I left for about 5 years. I had some other employment opportunities and came back as the public health director in March of 2020. Public health has typically been an understated response. Nobody usually knows what goes on with public health, so I think we're just very much out in the eye of the public. I would feel it's important to me that everyone understands that the people at the public health department, our nurses, our staff, they're doing an amazing job. Every single day they're calling people and talking to them about the symptoms that they may have had because of COVID, talking to them about what it means to be exposed to someone that has COVID, really helping people understand and educate them about what they can do to help protect our community. I think the mission of public health is really prevent, promote, and protect, and that is our mission for Klickitat County. Public health is about protecting and improving our communities, protecting and improving the health of the people in our communities, making sure that people have access to health in our communities. I think it's important for people to understand that the bigger picture that's happening with public health is one of the things we work with is our community partners and looking at preparedness. I've personally toured the hospitals, I've worked with the clinics, we're in contact daily with providers from White Salmon, Goldendale, the Dalles, Hood River, and many other agencies. Everyone is very well prepared. Everyone is doing a great job and doing the right things to make sure that we can decrease the amount of COVID in our community. Public health is rooted in science. We're trying to make sure that we get you the data that you need to make the right decisions to protect yourself and your family. The delivery of public health is an art. We've lost some of that art with a lot of politics. Public health should never be politics. COVID-19 is something we've not ever seen before in this country. It's not something anyone in the world has ever seen. We don't know how it's going to act. We have limited data. We're acting on the data that we have right now. Tomorrow that data may change and we will share that information with you. But until it does, please follow the guidance that we're putting out to protect your health and the health of your communities. Klickitat County is currently in phase 2. I think the important thing for everyone in the community to remember is that means that you can't have more than 5 people outside your household gathering in an area. Recently, we submitted an application for phase 3. Our application was submitted on July 1st. On July 20th, Governor Inslee put a hold on the phase 3 application and returned it to our county. They indicated that we would have to submit an entirely new application, an application the state hasn't developed yet, on a date that they haven't determined yet. So for now, we're gonna stay in phase 2. So it's important to remember again, only 5 people in a gathering outside of your household. Wearing a mask is really hard for everyone. I don't like wearing a mask, but every day I make a choice to wear a mask. I choose to wear a mask because I know that it makes a difference. I know that today there's data that shows that helps decrease the risk of COVID transmission in my community. I choose to wear a mask because I want children to be able to go back to school in the fall because we have decreased transmission rates in our communities. I choose to wear a mask because I think it's the right thing to do when I'm around other people who may be susceptible to COVID that I don't know about. Wearing a mask is only one of many things you can do. Wearing a mask, in addition to washing your hands, in addition to maintaining your social distance of 6 feet, makes a difference. The data that we know today shows that all 3 of these things decrease the risk of transmission. If you forgot to wash your hands, you still have your mask to cover you. If for some reason someone's within 6 feet of you, you still have that mask to help protect you. Make your choice to do all 3 things and keep our community safe. Every day, Klickitat County receives a lot of data regarding COVID. Before any data is reported out to the public or up to the state, we validate that information to make sure that you get information that is as correct as possible. There's a lot of discrepancies on any given day between the state website and the county website. There's a lot of systems that go into place that do the reporting. Not all of the systems talk to each other every day. Not every system works every day. It's important to remember that the people that are updating the information at the Public Health Department are doing so as other duties as assigned. While the data is accurate and up to date, we're currently working on what metrics we're reporting, how we report them, and the best information that we have for the community and what their needs are. Since becoming the Klickitat County Health Director, I've received a lot of feedback from the community regarding information that we've shared. Currently, our website is updated at 3:30 every single day with the most accurate information that we have available to us. We are working very hard at improving the reporting that we put out to the community, the metrics that we put out to the community, and trying to address some of the concerns about the information that we're sharing. So if you go to your healthcare provider and you're tested for COVID, and your provider calls you and tells you that you've had a positive test, a health department staff member will then call you and talk to you about who you've been in contact with, where you may have traveled over the last few weeks. They'll talk to you about what symptoms you may expect to experience. They'll call you every day and check in on you and make sure that you're safe, that you have the things that you need. Make sure that your symptoms aren't progressing and potentially ask you to follow back up with your healthcare provider. Once public health is done with their interview, the information is uploaded into a confidential database at the state level. Epidemiologists there will review all of the information, and that's where a lot of the data from the state websites comes in. Reports of either a positive or a negative test will be reported back to Klickitat County, regardless of if you have your test in the Dalles, in Portland, in Seattle. The test result will still come back to Klickitat County. If you test positive and then come back and see your provider and they order another test for you and it's positive again, we only count that as one case. That is one occurrence of COVID. This morning when I reviewed the numbers for both Klickitat County and surrounding counties, it occurred to me that we are doing a really amazing job here. People are wearing their masks, people are keeping their distance, people are washing their hands. People in this county are doing what we need to do to move on to phase 3, to get our children back in schools, to get our economy back on track. Thank you for doing everything you're doing, but please don't let your guard down. We are constantly working to improve the information we're sharing with you in the community. You can look at our website, Klickitat County Health. You can go to our Facebook page, and we also have an Instagram presence. Please be patient as we improve on what we have based on what you've asked us for.